Okay, so the DMEK graft is now inside the eye. To open up the graft, you tap the more open end rather than the more closed end. So it's where the arrow is pointing. Now, there's no point of you spending ages trying to open this up with a big bubble like this. So you want to remove as much of the bubble as possible without obviously, minimizing any trauma to the endothelial cells. And now I'm just trying to position the graft in a better position. Now you can see here, if you try to open the graft and you don't really have much space, it really won't open up. And also the two edges are on top of each other. So what we're going to do now is we're going to center the graft. There's different ways of doing it, but it's essentially by gentle tapping above the graft and sometimes into the limbus. And you want the graft to sit comfortably within the ink marks that you've created. Now I'm only holding down one edge only. And this is basically holding down and tapping the angle. So you can call it hold and angle tap technique. And you can see it opens up the graft really nicely. And on a next video, I'll show you how that works very well. Once again, I'm centering the graft. And as you can see, even a tiny bubble, ideally you want to get rid of, because even a tiny bubble can get in the way of opening up the graft. Now, we're going to open this up in a very different technique. First of all, I'm still centering it. So now it's got into a good position. You hold down and now you're tapping outwards. So you put your second instrument next to the first instrument holding down, and you tap outwards gently with that instrument, and you can see it opens up nicely. And that tiny bubble is still preventing the very opening of the graft at the end, so you need to get rid of that. Now we're going to show the two videos next to each other of the two of the main techniques to open up a graft. The first one, you're holding down the graft and you're tapping on the angle. And you'll see in future videos how that's very, very helpful. And the advantage of that is that you're not tapping on the graft itself, so theoretically less damage to endothelial cells. While on the other is the more established technique that's well known to more surgeons, where you're holding down the graft with one instrument, and then you're starting with your second instrument, tapping next to your first instrument, and you're tapping outwards. And they both work very nicely. I would say there isn't one which is better than the other. They can be used in different scenarios, as I'm going to show in the next couple of videos. So this is a DMEK graft, which is in a double scroll fashion. We're going to start by centering the graft in the anterior chamber of the eye. Now, the anterior chamber is due deep, so we're shallowing the anterior chamber as much as possible, because that's really the only way to open up the graft. We're going to start by tapping in the center. You can see the edges are moving apart now. Now we're going to tap them away from each other, and you can see here I've just tapped the angle once. We're doing it in slower motion. Just one tap and the edge opens up completely. One tap again and the edge opens up completely. So we're going to play it now in normal speed. Now we're going to open up the other edge. We've tried the angle tap, didn't really work, so we just tapped outwards, and that did the trick here. And you can see the graft is now nice and open fully. And now you just inject air in the anterior chamber to hold the graft. Here we're illustrating how to open up what can be a stubborn edge of the actual DMEK graft. So we're tapping gently outwards here. One side is opened up, and we tapped on the angle on the other side. And even though this graft is not fully circular, as you can see, once you tap on the angle, and we've just played that a number of times here, it then opens up nicely. And then you just tap on the limbus to center the graft. So here we're just tapping outwards to open up that edge, and the graft is nice and centered.